Well, the pandemic has drastically changed the day-to-day for hospital workers on the front line. And just to get a window into the new world, we are speaking with Maria Capobianco. She is the manager of respiratory therapy at Charlotte Hungerford Hospital. Thank you for being with us, Maria.
Thank you for having me.
One of your only moments where you don't have to wear a mask, because we know you're totally alone joining us by Zoom here. But what normally has your day turned into?
We normally have a busy day, but it's been pretty chaotic. It's emergency after emergency, learning how to just quickly put our PPE on, our masks, our gowns, going from one emergency to another. It's been pretty busy.
And how has this affected the way you think of your role and your team's role? Has it changed your thinking?
I feel that we quickly think on our feet. We are used to having emergencies. I believe that we have worked closely with other, with the nurses and the doctors. We've learned to just manage our time, and
and has it brought you closer together, would you say?
I believe it has. I think it's allowed us to really know what the other staff do. It's allowed us to get closer to each other and understand each other, watch over each other. Yes.
I'm sure you never imagined you'd be dealing with something like this, but I've also heard that you and your team feel like there's a desire to be there. There's nowhere else you'd want to be.
Honestly, I've never thought I would ever be part of anything like this. Despite the long hours and being pretty busy, there wouldn't be any other place we'd rather be than here.
How are you taking care of yourself? I know so many nurses are just stretched and healthcare workers. What are you doing, if anything, to just give yourself a little respite?
I'm fortunate where I get to go home to my children and my husband. We all work in the healthcare field, so we just kind of go home and have some time for ourselves.
That is important. We want to make sure that you guys are filling your cup a little bit, and we thank you for everything that you're doing, and thank you for sharing a window into your world.
Thank you.